As you take a look at the gyrations in the stock market here, what does this buyback mean for your shares?
So for us, it's a good reinforcement of the confidence we have in our overall portfolio of businesses and our growth outlook, where for 2022, we'll have another year of good, strong growth and expansion of the customers we're able to serve around the world. In support of that, we'll have about $12 billion of deployable capital. And while we'll invest over $1 billion in innovation, another $500 million into our venture program, it presented a great opportunity to reinforce the strength of our business by committing to purchasing a significant amount of our stock back. The intermediate term gyrations don't affect the overall repurchase program and the investment back into our company.
We're preparing, David, for an important speech tonight from President Biden, the State of the Union. We've spent the better part of this hour talking to the issues that he'll be addressing this evening. And I want to ask you about a big one that impacts you. The Senate's considering elements of the drug pricing legislation that was in what we used to call the Build Back Better bill. I realize that's not what we call it anymore, and it may emerge in a different form. To that end, though, that's what the president is expected to speak to tonight. As a large drug benefit manager, how does Cigna feel about that proposal, specifically Medicare negotiating prices for some of the higher cost therapies that are out there?
So overall, improving affordability for the benefit of Americans is a shared priority. And a public-private partnership to accelerate further improvements of affordability, we're fully aligned with. Two, the ability to further improve overall affordability of pharmaceuticals, for example, has to be looked at in conjunction with overall mental well-being and physical well-being. And our broad array of services are really well positioned to work with the federal government, state governments, health plans, and large employers relative to that. And we look forward to continuing to partner with the government to further improve affordability, but it's really through coordination of programs as opposed to any one singular price adjustment.
How about coordinating with the administration? Have you heard from this White House as a major insurer about this effort that he'll likely discuss tonight?
So I won't speak to any individual term, but we tend to collaborate aggressively because we view that healthcare policy is highly personal and therefore not partisan in any way, shape, or form. So we collaborate with the White House. We also collaborate with Congress. We collaborate with Health and Human Services. And maybe as a concrete example, we were first to step forward by providing an insulin-based program that capped the cost of insulin to members at $25 per month. We shared the design of that program with HHS, and that actually became an underpinning for some evolved programs for seniors through Medicare. So yes, we do collaborate with this White House as well as with other influential leadership within D.C. proper.
We're seeing mandates for vaccinations, for masks come down in this sort of post-Omicron phase that we're in, David. Are patients returning to care now that we're seeing Omicron fade?
So what we've seen broadly, now we're at the 2-year mark, so it's been a long journey. Early on in the pandemic, we absolutely saw a decrease in utilization of medical services outside of COVID. But as you went through the first year, in the commercial space, so those insured through employers, we largely saw consumption of services in line with historical averages. In Medicare, we saw most of the services in line with historical, and for Medicaid, we saw it below. So to answer your question, we're in an environment right now that consumption of services are more in line with historical levels, and then there's some COVID utilization above and beyond that, depending on the geography or population you're serving.
It's one of the best indicators we have getting back to normal. Go ahead, Dave.
Yeah, as a company, we've been very active in terms of ensuring that even through the pandemic, preventative care and what's called evidence-based care, so support of pharmaceuticals for those on chronic disease, has stayed quite constant over the 2 years, and we're proud of that.
David, I want to ask you about what's happening in Ukraine. I know you have a number of customers and clients in that region. Give us the view of a corporation that's trying to navigate this conflict in the middle of a crisis here, in the middle of a war. I understand you've set up a team that's focused on checking in and caring for those clients. What kind of needs do they have? Are you hearing from many of them?
Yeah, we're a global health service company, so we literally have customers everywhere in the world. Specific to what's taking place in Ukraine, before we get to our customer programs, all of us within our company, as well as across the United States, our hearts go out to the citizens of Ukraine who are going through a rather horrific environment. Specific to what we're doing in support, our foundation has been activated. Our coworker giving program and matching program has been active. The customers we serve in Ukraine and in the region region are being supported through our existing programs and then elevated access programs, hotlines, outbound communications, SMSs, et cetera, that we're able to bring the breadth of our global resources forward. So we'll continue to press ourselves to provide whatever support we can to our customers as well as to the citizens in that region.
Based on what we're seeing in Ukraine, David, this could become a much more difficult scenario in the next couple of days as Russia bears down. Are you seeking redundancies or other ways to communicate with clients, or even if you have employees in that region, if, for instance, power goes out, cell phone signals go down?
Simple answer is yes. Again, being a global health service company, we support some of the largest IGOs, intergovernmental organizations, and NGOs, non-governmental organizations, as well as large corporations. So while not this is something that you're used to, you have infrastructure in place to be able to deliver with all types of disruption and putting the needs of those customers front and center and the local communities. We will press ourselves in every way, shape, or form. And to your point, leverage redundancies and leverage some creative innovation of our local resources to make sure we're supporting our customers.